As President Biden marks this extraordinary loss, the next steps in tackling this pandemic come with significant and immediate challenges. I want to bring in ABC News medical contributor Dr. Darian Sutton, along with senior policy reporter Ann Flaherty, for more on this. Dr. Sutton, the real toll goes far beyond just these 1 million people who died. The National Academy of Sciences estimates that 9 million family members are grieving a loved one lost to this virus. So how hard was it not only to see some of these deaths firsthand because you were working on the front lines, but also to deal with these family members after the fact, to have to deliver that news, especially in the beginning when family members were kept away?
It's been incredibly difficult. There has been a collective grief secondary to these losses, and people have to realize that each one of these numbers represents a loved one, a family member that meant something to someone. I've experienced this professionally, as you said. Unfortunately, clinically, I've been tasked with, unfortunately, declaring deaths of some of those who have succumbed to the virus and having those difficult conversations. And I have to say that grief is more difficult now. Not only are more people experiencing it, but many people weren't able to end their understanding of that person's life because it was often sudden and unexpected. And I want to remind those that need it, it's okay to ask for help. And there's also a disaster distress helpline that is put in place to help those dealing with emotional distress secondary to national disasters.
Great advice there. And the World Health Organization is now estimating that global deaths could really be more than double the official count. Why is it so hard to track these numbers, and what do we know about the real scale of this?
Well, the real scale is absolutely unprecedented in history. I mean, we eclipsed the 1918 Spanish flu a while ago. And, I think this is so difficult to track. Many countries don't have good tracking mechanisms. And a lot of the complications from COVID is what people initially present to hospitals with. So it becomes difficult to know, are they there for COVID? Are they there for other illnesses? One of the things that I think has been so interesting in this pandemic is that we can track something called excess deaths. And, there's a baseline every year, a general death number that we see in this country. The first year of the pandemic, we were well over 500,000 deaths in excess of that annual rate. And last year, it was even higher, and it's now the third cause of death in the United States. So, if people are out there still denying that this is at all as catastrophic as it has been, or that it's trying to compare it to the flu, this excess death number is the one to look at.
Dr. Sutton, an ABC News analysis of federal data shows a growing proportion of COVID deaths are now vaccinated patients. So how concerning is that? It's still a majority unvaccinated, but the fact that that vaccinated number is growing, how worried should we be?
I think it's showing the increased risk of vaccine effectiveness. Although vaccines are remaining incredibly durable, there are still those who are at risk, which include those who are pregnant, immune compromised, and the elderly. And so what we're looking at is waning vaccine protection, which is expected to happen over time with any vaccine. And the virus is targeting those who are most vulnerable. And it's a reminder that if you haven't done so already, to get boosted. Only approximately 30% of those eligible have gotten their booster dose. And also, we need to vaccinate our children. It's estimated that approximately 30% of those aged 5 to 11 have obtained their primary vaccine series. So this is really important in stopping the spread of this virus.
And President Biden says that the U.S. will now share its COVID-19 technology with the World Health Organization. Why now, and how significant could that be?
So the Biden administration says the NIH is going to be licensing this technology that they have, a stabilized spike protein that they can give to other countries. This is a technology that's absolutely essential to creating vaccines and treatment. So this is important because it's going to encourage other other countries to do the same and to share their technologies. It opens it up and saying, hey, this is a global problem. Let's come up with a global solution. It also helps that we're not going to just be sending out doses to other countries, because you almost can't keep up with all of the variants and the spike in numbers. So this will help countries do what they need to do, which is produce their own technologies. Of course, then the question becomes money. Do they have the resources to do that? And that is TBD.
Now, Dr. Sutton, a new CDC forecast shows hospitalizations and deaths are again expected to climb over the next 4 weeks. How concerned are you about this expected summer surge?
It's something that is to be expected. I've been looking at these numbers over time, and we're in an active surge where we've seen the case rate increase by approximately more than 50% in the last 14 days. And now we're seeing that subsequent increase in hospitalizations. Luckily, the increase in hospitalizations is not the same as it was, where it was very much one-to-one in prior surges, thanks likely to vaccines and the hopefully the fact that this new variant is less harmful. But it does remind us that we still need to remain vigilant, and we can't just forget about this virus. We need to take what we've learned and use those mitigation efforts to reduce our risk and the risk of those around us in our everyday life.
So, Anne, are federal agencies or state and local governments showing any signs of looking to maybe reinstitute policies like mask mandates?
Well, Diane, I'm not saying an appetite at the federal level, and certainly not in an election year. I don't think that it's a mistake that the Biden administration is not making a big deal about these 1 million deaths. Of course, they certainly want to market, but they've made all indications that they want to move past this. They want to talk about other things. They want to address inflation. So I do not see an appetite for this at this point.
All right, Ann Flaherty, Dr. Darian Sutton, thank you both.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.